All right, good afternoon, everyone. My name is Rick Pollock, and I'm with the Cholangiocarcinoma Foundation. We'd like to thank you for attending this week's webinar. This week, we invited our friends Sophia and Deven from Citizen to talk about patient health data rights and privacy. Please use the Q&A icon or the chat feature on Zoom to ask your questions. And with that said, I'll turn it over to Sophia.
Wonderful. Hello, everyone. My name is Sophia. I have the pleasure of working closely with the foundation to bring our platform to your community. Looking forward to today's discussion. First, I will begin by introducing Deven. So Deven McGraw is our Chief Regulatory Officer at Citizen. Previously, she directed U.S. Health Privacy and Security as the Deputy Director of Health Information Privacy at the Health and Human Services Office for Civil Rights. It's a mouthful. Deven is the real deal, and she has watched over health privacy at the highest levels of government prior to joining us. In addition, she's the Chief Privacy Officer acting currently of the Office of the National Coordinator for Health IT. She is widely recognized for her expertise in health privacy and has directed the Health Privacy Project at the Center for Democracy and Technology for 6 years and led the privacy and security policy work for the HITECH Health IT Policy Committee. She has also served as the Chief Operating Officer of the National Partnership for Women and Families. She advised health industry clients on HIPAA and compliance and data governance, while a partner at the law firm Manatt, Phelps Phillips. Deven graduated magna cum laude from Georgetown Law Center and has a master's of public health from Johns Hopkins. Yep. Deven is not only a privacy officer, but just an extraordinary member of our team who cares deeply about patients and safeguarding their privacy. We feel incredibly lucky to have her at Citizen, and I'm just really looking forward to the conversation today. So with that, Deven, you want to take it away?
Yeah, no, sure. Thank you, Sophia. It's been a long time since somebody read my entire bio. Appreciate it. I'm a little embarrassed, but I'll get over it. Thank you. I want to say, first of all, before I pull up my slides, that we're going to focus most of our conversation today on the rights that you have to get your health information and why that's important. And we'll talk about what we do at Citizen to make sure that that health information that is your right to have is at your fingertips and usable by you for your own care, to find clinical trials, and to donate it for research purposes. It's an issue that, among all of the issues in privacy that I'm passionate about, and I'm passionate about a lot of them, the right of people to get data about them is top of the list. One of the things that I'm most proud of that I worked on while I was still in government is some really pretty extensive guidance on the right of individuals to get their health information. It's been in existence for a really long time, a couple of decades actually, and yet people still struggle to do this, and there is widespread misunderstanding both on the part of patients and also on the part of healthcare providers about this right. And when I was in government and Anil Sethi, our founder, came to me and said, I want to start a new company that really does the work to put the power of data in the hands of the patient, and will you join me? I couldn't say no. Even though it meant a move all the way across the country. It is my passion, it is my life's passion. I feel like we're realizing it, and I want to help you all realize it too. So with that, I'm going to share my screen and show some slides. Give me a second to give you a better format here for these things. Okay, are you seeing a slide that says Citizen on it? Okay, good. All right. We don't know this guy, but he made a good stock photo for a slide introduction. So again, really starting with cancer. I mean, I think we ultimately want to be a company that serves all people in need of their health information, but we're starting with cancer, and we have a really good reason. for starting with cancer. That's Anil, our founder, on the bottom. It's on my right. It might be on your left, depending on how you're looking at it. That's his little sister, Tanya, who died of metastatic breast cancer a couple of years ago. I'm actually in the center picture. That's my walking gallery jacket, which someone painted my passion for getting patients their data on the back of a jacket, and I wear it. I get lots of comments on it periodically. And then in the other corner is one of our advisors, Stacy Tignano, and her mother, who both have are survivors of breast cancer. So again, we're starting with cancer, and we're empowering patients with their personal health data. And what do we mean when we say health data? And there's lots of data that really can be considered to be health data. I mean, frankly, data that comes from, if you wear a Fitbit, or if you keep a diary of of the foods that you eat, or if you're sort of regularly journaling about your stress levels, like that's all technically health data too. But the health data that we're going to focus on for this presentation is the data that you have the right to under HIPAA. And it's a lot of data. It's not just what you might see in your portal. Like, a lot of us, myself included, I have a portal into my provider's records, and I get to see what my lab test results were, and I get to see, what my latest prescriptions are, but there's not a lot of detail in there. And frankly, what you have a right to as a patient under federal law is much more data than is being affirmatively given to you in these portals. I mean, medical records, emergency visit records, medications, genomics, genetic and genomic testing, if you've had it done, imaging, your x-rays, your MRIs, your scans, lab results, not just the reports from those scans, but the actual scans, lab results, surgical reports, any record that gets generated about you as part of care that is used to make decisions about you is part of the information that you have a right to. That actually also includes records that your health plan may keep about you, about health claims and how much was paid. And that's all that stuff. Those are decisions that are made about you too, when they make decisions or to pay your claim or not pay your claim. Like, that's all information that you have a right to under HIPAA. It's a lot of information. And what is the value of this data? Again, when you have it in your hands, it's one thing to say, well, my healthcare providers should have it, and they have it, or they should have it, and they use it to help take care of me. But if you're really interested in sort of being more involved in your care, or empowering a caregiver to help you through your care, you need that data. You need that data. It is your right to get it, and it is really almost your passport to being in control, to being in charge, to sort of being able to take more initiative and to be really quite proactive in your care, as well as with respect to powering research. Making sure that that anybody that comes behind you has a chance for it to be better, and maybe even to help yourself as well through clinical trials, for example. So improving care coordination, your ability to get second opinions is sometimes dependent on an ability for the next clinician or physician to have all of your data. Empowering caregivers to help you, being able to match to a clinical trial, being able to get a virtual tumor board, for example, to give you a precision medicine recommendation if you've had some genetic testing done. And then again, sharing with registries and research. Those are all some of the things that you can do when you have that data. Otherwise, you're dependent really on somebody else making sure that that data is put to work for you. And that doesn't always happen. So let's dive in a little bit to what the law provides and this is US law, and it applies to US healthcare providers. And what it requires is, that all information, and this is a requirement, not, well, you should really do this. It's like, you really have to do this if you are a hospital or a doctor or a health plan that is covered by HIPAA. And that's most of the healthcare providers in this country. They need to make available to you information that's in a designated record set. That's a little bit of a technical term, but it really does include all that information that was on that prior slide. And so again, this law has been in effect for a while. How easy is it for you to get your health information? It is not easy. It is way harder than it should be. There are some initiatives that that the federal government has frankly put taxpayer money on the table for, to make it easier for you to get more information out of a portal, to be able to use an app or a service to connect in and get that information really quickly. But those efforts have really just begun. There's still a lot of kind of legwork and phone calling that has to take place in order for you to get your records, and usually only during business hours, just the time when people have, a lot of free time on their hands to spend hours and hours on the phone chasing their information down. It is too hard for that to be sort of a genuine right. And we realized this right away when we started to help our initial users to get access to their data. And we really wanted to do something about it, not just for the people who use Citizen, but really for everybody. And we started to do webinars, and we've done a couple of other things, which I'll talk about in a minute, to try to raise the bar on compliance with this HIPAA right of access, because we really believe this data is key to, giving people information that they need to seek the best possible care for themselves and also to make a difference. So let's break this down a little bit more in terms of the components of the right. And you have to ask to get all of this information. The portals, again, may be a way for some information to come to you without you necessarily having to ask for it. But for the most part, in order to get everything that you have a right to, you have to submit a request in writing, but the entity is supposed to have a process that will enable you to do this without having to come into the office. They can also take reasonable steps to verify that you are who you say you are. Now, if you do happen to be showing up in person to get your records, that's pretty easy. You're standing right in front of them. But if you're doing this remotely over the phone or by email, you need to have a way to tell them that, I really am Deven McGraw and these are my records. And so when we get records for our users, we ask for a copy of driver's license, official photo ID, so that we can prove to these medical records offices, no, this is this person, and they have authorized us to get this information. And that's the only reason why we use that piece of identity. But that's the reason. The entities protect this data. They don't want anybody calling them up and saying, well, give me Deven McGraw's data, without knowing that's really Deven McGraw. So they can take steps to verify identity, but they can't make their process for releasing information to you so hard that it creates an obstacle to you getting your data or unreasonably delays this access. And a key example, which is one I just brought up, is, oh no, you have to come into the office to come and get it. And, we just were talking with one of our users the other day who was told by a healthcare provider, no, you must come and get it. Even though they are an hour away, and even though during times of COVID, it is not wise for this user who has cancer to be showing up in a healthcare facility when she's not needed. She doesn't need to show up there to get care, just to pick up her medical records.
Deven,
So,
one of our patients, they were told that they needed to fax their records in.
Oh, the request form? Yeah, we get that. This is one of those things where, when you're out of government and you realize that your guidance stopped a little short of where it needed to go, and this is a key example of that. An entity, a hospital or a doctor, they have to set up some way of you requesting remotely, but unfortunately they can tell you that you need to fax us the request. I think it's awful if fax is the only way that you can get it to them, because what patient, I don't have a fax machine. We have a fax service that we use at Citizen, so we don't have any trouble meeting that requirement for our users. We fax requests to entities all day long, every day. But I find that is so unreasonable. Sometimes a simple phone call to say, look, I don't have a fax machine. Can I email it to you? I will be able to email you proof of my identity. I mean, because really, what's the difference between fax and email, frankly? But a lot of these institutions and doctors' offices, their processes are just really outdated to modern technology. And some of them actually think that they're not allowed to accept emails from patients, which is, another topic altogether, which I could wax poetic on. But they can't make you mail in the request, and they can't make you come in person. That for sure you can push back on. But unfortunately, fax is one of those, healthcare is just dedicated to that darn fax machine. One day we are going to take sledgehammers to every single one of them. But for now, we're having to live with them a little bit. Good question though. Okay, so here's another piece of the right of access. You actually get this information in the form and format and in the way that you want for the most part. So I call this have it mostly your way. I don't know if anybody's as old as I am and remembers the old Burger King commercials. Have it your way. You can almost have it exactly your way, depending. So you have the right to get this in the form and format that you want, as long as the entity can readily produce it that way. This is an issue of capability, not willingness. Find a lot of times some of these medical record offices, they've got one process and one way of doing things, and they want you to just, that's how you get it. You're getting it on paper because that's how we did it, and that's how we're going to keep doing it. And the reality is, no, if you want it electronically, if that information is kept electronically, which increasingly more and more records are in digital format, they have to have a way to produce some type of electronic copy for you if that's the way that you want it. Even if it's a PDF that is emailed to you. And that's another thing. You have the right to get your records by email if that's the most convenient for you. And it doesn't matter if you're just using Gmail or Hotmail or some other, or you're using your work email. Like if you decide that from a privacy standpoint, you get it, that there might be risks that might get intercepted or seen by someone else, but it's just darn more convenient for you to have it by email, you can get it that way. The entity has to ask you, that's unsecure, are you sure? But as long as you say, yep, this is how I want it, I get it, thank you. On the other, so you have the right to get it that way. On the other hand, if you are very worried about what will happen to your records if they're sent to you unsecurely, you have the right to get them securely. In some cases, people have said, put the records in my portal and I'll get them there. I have found that doesn't work in most places, only because the portal doesn't have the capability to have data inserted into it. It can only display what it displays, what it currently displays, versus, oh, I would really like my images or my x-rays, and can you please put them in my portal account? It's pretty rare for that to occur. Generally, any form or format that you request that they can produce, they have to comply with, unless you're asking them to do something that would introduce a security risk into their system. Like you can't walk in with a portable drive, like a thumb drive, and say, can you just insert this into your systems and download all my data on it, and I'll just take it with me, because there might be a virus or malware or something on that disk, and that would cause a risk to them. But if they can give you a disk, they might be able to charge you a bit for it, and we'll talk about that in a minute. But they can give you a disk. We get, it's not unusual for us to get images from our users, for example, by CD, which we then upload to their account, because image files are gigantic and can rarely be emailed because they're so large, but they can be produced through, by providing you with a CD. Not everybody has a CD reader, so that's not going to work for everybody. Generally, if you're asking them for a particular form and format and manner, there should be a negotiation, right? This is what'll work for me. Can you do it? No, we can't do it that way, but we can do it this way. Will that work for you? And you get agreement on it, not to shunt you to like a process that does not work for you, or is not going to produce something for you that is going to work for what you need. We have found that this is one of the primary ways that entities are out of compliance. This, I'm not going to give it to you in the form or format or in the manner that you're asking me. An email, frankly, is a big one, where institutions just dig in their heels and they say, no, we will not email this to you. And the guidance that I helped to write when I was in the federal government is super clear on the right of patients to get any data that can be sent by email. Again, image files usually cannot, but all the text files more than likely than not, can be sent by email. And they are supposed to do that for you if that's the way you want it. And we find time and time again, nope, we won't do it. Nope, we won't do it. So this is, it's, you know, it is one area, unfortunately, where people who, it's hard to push back on your healthcare provider, frankly, when they're putting these obstacles in front of you. And that's, you know, it's one of the reasons why we like to do this for our users, because it shouldn't be on you. Like we, you know, sometimes you need some help, but I still want to empower you with the information because I think it's important. Okay, timeliness and fees. I hinted at this earlier. So unfortunately, the regulations do give these entities up to 30 days to produce these records. That is lousy for a cancer patient. It's horrible. The regulations need to be changed. We have advocated for those changes. I do think that ultimately that rule will be changed, but it hasn't been changed yet. And it wasn't something that I could change just in guidance. And so they can take up to 30 days. We are pretty assertive, some people might say aggressive, about getting records for our users. And we beat that deadline more often than not by about a couple of weeks. And sometimes we get records the same day or the next day because of some of the relationships we've built with providers, but they can take up to 30 days. We did in the guidance say, well, we expect you to respond sooner. We think you can, but there was not much we could do to make people respond sooner. It is in the regulations that an entity can charge a limited fee for a copy that you are requesting for your own use. And it's limited because it's only the amount of time that it takes for them to actually make that copy. And this is where that form and format issue comes into play, because if it's a digital record, you're asking for a digital copy. How long does it take to press 2 buttons to get you that copy? Not very long. So there is, the amount of money that you should be charged, particularly for a digital record, should be very low, if not, close to zero. Paper records are another story. When the records are older and they're in paper and they have to feed it into a scanner to get you a digital copy, or they have to stand at a photocopier to get you a photocopy of your records, that can depending on the size of that file, that can become more expensive. But generally, there are a lot of institutions that if it's really for the patient, they will not charge. That has been our experience. But we also have seen entities that, there are provisions in state law that really don't apply to patients getting their own records, but hospitals and doctors don't always realize that HIPAA, the federal law, is the law that controls here, and they can't charge those state law fees. Those state law fees tend to be high. Periodically, you get a state where the state says, oh, well, patients get at least 1 copy a year for free. That's a beautiful law. There should be more of them. It's unfortunate that there are not more of them. And that law would obviously control in that state. But generally, again, HIPAA's fees are way lower than most people get charged. This is another place where patients get discouraged. They get invoices for hundreds of dollars for their records. They get, charged basic search fees, and, oh, well, we have to charge you for how much time it takes us to find your records. Well, no, actually, you're not allowed to do that under the law, because patients shouldn't pay for your messy records. Like, if it takes a long time for them to find Deven's records, I'm sorry, that's on you. But once you found them and you're making me my copy, then I might be able to be charged a reasonable amount for that. And then, of course, if there are supplies, like if you do say, well, if you've got a thumb drive, I would love it on a thumb drive, they might charge you for the thumb drive, but it has to be the cost of that thumb drive. They can't decide that they are suddenly a profit center in thumb drives and charge you like $15 for a thumb drive. They don't cost that much. They're like $5 at the most. Paper too. We got one the other day. Hang on. It sounds like I have a question, but I want to tell this story because it's just, we got charged for some paper records. And first of all, they were like, okay, $20 because it took us an hour to make the copies at a labor rate of $20 an hour. These are paper records. It's actually, that's within range. But then they said, oh, we're also going to charge you for the paper at 25 cents a page. Like, in whose universe does paper cost 25 cents a page? You can buy a ream of 500 sheets of paper from Staples for $5. That's like less than a penny a page. So at any rate, this is one of the things that we do for our users, is to sort of cut through some of that crap, for lack of a better word, to make sure that that people are getting their records in a way that is compliant with the law. So Sophia, you were about to ask me what I'm sure is a really good question.
Deven, do you want to maybe touch on how Citizen handles the fees aspect, both
Sure.
if they're unreasonable or if they are reasonable,
Yep.
and what patients should do if they are getting crazy bills,
Yes.
which shouldn't be happening?
Yes, no, absolutely. So we at Citizen, we handle every aspect of this process for you. And we're in a really good position because I know what an invoice looks like that is allowed and what is one that doesn't. And we're in a really good position to judge which fees are HIPAA compliant, and we pay them. When we get charged a HIPAA compliant fee, we pay those fees. We pay those fees for our users, and the service is still free for you to use. But occasionally we do have entities that will send a bill to the patient. And whether that bill is small or large, we tell our users, do not pay it, send it to us, let us fight this battle for you. And if it's not a battle to be fought, if it's a legitimate charge, we will pay it. Periodically, we have had a few instances, really, I can count them on one hand, of all the thousands of requests that we have put in, where the entity is just this gigantic paper record. There is no digital copy. Somebody literally spent hours in front of a photocopier copying it, and the charge for the records is enormous. That's one where, we might not be able to afford to pay for it, but frankly, that comes up so rarely. More often than not, the invoices are for charges that they can't charge the patient, and in which case we will fight that for you. And there are also invoices that are legit, but you as a Citizen user, you don't pay those. We do. Did I answer that? Did I answer the question, Sophia? Okay, great. Yeah, the fee issue makes me mad. Can you tell? So I want to say, this is, the times are changing. If I had a better voice, I'd sing it a little bit for you, but they're not changing fast enough. And by this, I mean, there really are some federal policies that are going into effect over the next 2 to 5 years that are going to make this so much easier for everybody. More comprehensive records that you can get right through your portal, an ability for Citizen or any app that you would choose to just tap into all of those portals and get and aggregate all that information for you. That is what we do today. We just can't do it by connecting into your portals, because the bulk of the information that you need as someone with cholangiocarcinoma is way more than you can get from a portal. So we know that. And so we go directly to the source to get all of those records and take care of that for you, because that is the foundation for, everything that you need, and everything that we need in order to help you. So this will get better over time, but it isn't better yet, and it won't be better for 2 to 5 years. And that's too long, frankly, for cancer patients and for people who are sick. We need fast access today, and hence one of the key reasons why Citizen was born. So I'm going to talk a little bit about our scorecards. So I mentioned earlier about how, the failure to send records in the form or format that the patient wants is the sort of the top reason for non-compliance. So when I first started working at Citizen, and we first began, frankly, with our first 10 patients to gather their health information, I Well, first of all, I thought, well, I wrote this guidance. I wrote this really good guidance, and we worked really hard to get it published. And so it really shouldn't be that hard for us to get records for our users. And boy, was that a slap in my face. Like, it's like I might as well not have even written that guidance, because people seem to have not read it. And there was non-compliance all over the place. And it was hard initially. We made a lot of phone calls. We talked to a lot of privacy officials. We did a lot of work, and we realized that nobody out there was reporting on just how hard it was for patients in a way that actually held some providers accountable for their failure to comply with the law. So we decided to do a scorecard. We decided to actually use the experience that we had in getting records for our users to give providers a score on how well they were in compliance with the law. And we gave them lots of chances to do good. The entities that were terrific and were easy to deal with and got records for our users in 5 days or less and didn't charge a dime for those patients, we gave them a score of 5, and we highlighted them and said they were great. But there were a lot of providers who were not in compliance with the HIPAA right of access, who didn't even have processes that would allow for a patient to provide a request remotely, who were adamant that the records would be sent on paper, even though they were digital records and the request was for a digital copy. So we did a scorecard, and the first scorecard had just I think a little over 100 providers, and it published in August of last year. And more than 51% of those providers were out of compliance with one or more aspects of the HIPAA right of access. And we didn't stop there. We did it again. We published another version of the scorecard in November of 2019. And we had more than 200 providers on the scorecard. And we still had 51% of providers who were out of compliance. But we were starting to see some movement, because there were way more providers, higher percentages of providers who were providing, seamless access. That's a 4-star score. Or they were going above and beyond what HIPAA requires, the 5-star rating. And those categories were increasing, even though the numbers weren't budging at the bottom in terms of 51%. Well, fast forward to the most recent version of the scorecard, which we published in May of this year. 830 providers on the scorecard. So exponential growth in terms of the number of providers that we've been able to score. And this time, the number of providers who were out of compliance dropped to just over 25%. And the numbers who were getting 4s and 5s was like 2/3 of the entire sample of 800. So things are improving, we think. Now, they may just be improving for citizen users. And that's something that's hard for us to control for on this scorecard, because what we have direct experience with is the work that we do to help our users get their health information, but it still gets talked about. We published a paper for peer review journal publication. So we took this incredibly seriously. It was not really just about us. It was about, like, how can we make a difference in this field and make it so that all patients have the kind of experience that we're starting to have for our users, which is, seamless access, sometimes same day access, more, increasingly same day access without being charged any fees at all. So I think that despite that, probably each of you may have had some issues with trying to get your records in the past when you've tried on your own. Again, that's the reason why we exist, is to help you do that. And we get it done. And we are hopefully improving the process for how that gets done for patients who are not using Citizen, because we're not available to everybody. So just go over, we've gone over some frequently asked questions. How much does it cost? And this is really about Citizen. Like, it's free for you. It is free for you. What do we do with your data? Well, first we get it for you. Then we make it pretty. All your underlying documents are there, but we pull out the relevant information that will be needed for like a second opinion and for clinical trial inclusion and exclusion criteria, and make sure that that is highlighted and standardized, but still with what's called provenance. So, anybody who looks at that information can see where that came from. Like, it came from this lab report taken on this day from this laboratory, which is often important. How can you use this data? I mean, we talked about that. You could use it in whatever ways you want to, frankly. It's most useful for helping you get the best possible care, and for you to pay it forward for research purposes. How do you keep your profile up to date? Let us know when you've been back to the doctor so that we can go and get those records for you to refresh. We'll take care of getting the records. Just let us know when you've been. And we'll periodically remind you in case you forget, because we know you're busy. You got a lot in your minds. How many facilities can you request records from? As many as have records that are relevant to you. Most people have between 3 and 5, but some people have 10, 15. Some people only have 1. It really differs. Can you request records further back than 10 years? We can try. Generally, what we have found in trying to get records for our patients is that the entities don't keep them forever. And it's rare if they keep them for longer than 10 years. And there's nothing in HIPAA that requires them to keep them indefinitely. So if you're on the fence about whether you should do this or not, it's another reason, another factor that you should put on your scale of considering whether to get your records or not, whether to use Citizen to help you get your records, because the entity won't keep them forever. And you should have them in case you ever need them. My loved one died of cancer. Can I request his or her records? So in some cases, yes. The HIPAA right of access applies to persons who are deceased, and someone who is the heir to the estate of someone. I mean, these are technical terms, but essentially if you have some sort of legal authority to present, next of kin is sometimes not enough, but someone who, essentially is a successor from a legal standpoint to someone who has died. So a spouse is a really good example of someone who is typically someone who can request those records. It's not as easy as getting them, from someone who is live, but that right is there. And I think the most complicated aspect is what documentation do we have to show to the healthcare facility so that they know that the person requesting the records has a right to those records. And some facilities don't care. Like, you just say, I'm a family member, and they'll give it to you, but others are really pretty persnickety about it. And it's really just a matter of working with them to figure out what kind of documentation is acceptable to them. But it is part of the right that someone who has died, their records are still available. It's just a matter of making sure that someone who legally can exercise that right gets them. And then once they're in the Citizen account, frankly, then it's really up to the Citizen user to decide who among the family can see them and what happens to those records. I think I'm close to the end. I'm going to stop screen sharing so I can see people and see what kind of questions we've come in.
Wonderful. Well, thank you, Deven.
Yeah.
Really appreciate you walking us all through our rights as patients. I think a lot of us, if you're like me, didn't realize just how much the federal government grants us in terms of rights to our medical data. Yeah. Unfortunately, as you mentioned, it's still hard. And it puts a lot of onus on patients to advocate for themselves, to tell people, no, you can send it via email. And in many ways, that's why we exist, is to make it one less thing that you have to deal with in coordinating your care. Your records are the foundation of doing so many things, and we want to make sure that every cholangiocarcinoma patient has that access, and in a way that is easy to navigate, use, and make actionable. Because it's one thing to have all your records in in a binder. It's another to be able to actually use them and share them easily. So that's why we're here. I hope everyone enjoyed the presentation. If there are any questions, I invite everyone to use the Q&A box to enter questions. And then I see Stacy Lindsay has asked a question to all the panelists to talk about what our health data is specifically used for. I see that it is framed as research, but can you explain how our health data is used for research?
Sure. So we surface opportunities to our users to share their data for research that is going to, that may benefit the individual, but is likely may not, but to be able to sort of, put their data to work, not just for them, but to really pay it forward, right? And we give people the option. If you want to share for research, we will ask you if you want to share for research, and you can tell us if you're comfortable with that. And we ask you kind of at right as you onboard, like, is this something that you're really comfortable with? And you say, yes, I'm all in. Share my data for research purposes, and we're working with CCF to identify research opportunities, and I'm sure Sophia can talk a little bit about some of the stuff that we're working on. But natural history studies, sharing your data to find out if you match to a clinical trial are a couple of examples. Again, I'll let Sophia talk about some particular projects that we're working on with CCF, but it is really up to you, and you can decide you're all in for all types of research, or you can decide on a per project basis. Like, I want to hear about these opportunities individually, and then I'll decide. And you can have it your way, whatever you are most comfortable with. A lot of people just sort of like to set it and forget it, and you always have the opportunity to change your mind. But others are a bit more cautious and want to say, no, I want to hear about each one of these individually, and then I'll decide. And you can do either one of those. So Sophia, do you want to add about some of the other?
Sure thing. For many patients, when you say research, the initial thought is clinical trials. The reality is that research is actually far more expansive than just the research that is done in the clinical trial setting. It's really just one, call it sandbox of many. And really what Citizen allows you to do is to choose the types of research that you want to support, whether that be seeing if you're eligible for a clinical trial, or this increasing area of research called real-world evidence. And actually, recently, Alexa Burke, our head of research, did a webinar overviewing what real-world evidence is and introduced a real-world evidence study that Citizen and CCF launched last month called the Real-World Genomics Study, that is seeking to understand how genomic testing is being conducted and used in cholangiocarcinoma patients. So this is a research opportunity that is currently available and live that you can participate in by signing up for Citizen and consenting to share your records for research. And all of the really valuable information in your health records basically puts you in a position to contribute and help us understand really important questions in the cholangiocarcinoma community without really having to do anything other than give your consent if you would like. You don't have to fill out a survey. You don't have to drive to a trial site and be screened and be eligible. You have so much valuable information in your medical record. Our hope and through our partnership is to unlock that, put you in a position of power to have access to it first and foremost. As Deven just spoke, using your rights to that data, but then also choosing what happens to it. You can choose never to share it with anyone. That is completely your right. You are just as entitled to your free Citizen account as someone who does want to share. That choice is yours. But we also are working together to make sure that we have really compelling research opportunities for you to contribute to, so that together we can better understand its disease and ultimately create more options. So research is far more than clinical trials, which is why it's even more important that you have control of your health records.
Yeah. And I would say some other examples that I love that study. Some other examples are, which treatments work best in which subpopulations, right? Like something that works really well for women might not work as well for men. Something that works really well for people who are Caucasian does not work well for African Americans or people Latino. So it is, there is so much of what we don't know about cholangiocarcinoma, and so much that we need to know in order to create more effective treatments, to understand why this happens, and how we can fight it better, and through ideally through treatments that are less toxic. Like the list is endless, but at least if the data is available, like we hope that we have taken an obstacle off the table, right? Here's the data. It's there, it's ready. There are people who have said yes. There are people who have said they will contribute this data to research. Come get it, researchers. And we're starting really with something that we're taking the initiative and doing some research, but I think it's going to be incredibly compelling, because getting data and getting research volunteers is a huge obstacle for researchers. So let's take that off the table.
We have Frederick, who's actually one of our attendees today. He's actually already signed up, and he wanted to share his experience. Frederick, are you there? I think you just need to unmute yourself now.
Can you hear me?
Yep.
Yeah.
I was diagnosed late October last year, and in the doctor's office, I'll try to keep this as short as possible. It was a God wink. My wife was reading a cancer journal while we were waiting to see the oncologist. She's reading an article on breast cancer, turned the page, and there was a 2 or 3 page article on the Cholangiocarcinoma Foundation, which got me in touch with Melinda. And Melinda immediately said, look at Citizen. And she gave me the contact information for both Lisa Bellevue and Mikkel Bunch. Lisa, I think, kind of sets up and coordinates the initial connectivity. And I love talking to her because she has a beautiful British accent. And Mikkel, I think, does more of the system connectivity with my healthcare providers, for lack of a better term. And I just want to say what an outstanding organization you all have. All my records are on file now. In August, I will be going to MD Anderson for a second opinion. Everything's there. And I was very surprised MD Anderson, I'm getting emotional, sorry. Really wasn't aware of Citizen yet. And I'm a big advocate for what you guys are providing. It's unbelievable. As a matter of fact, whenever I'm at chemo, I talk to other patients about how they accumulate all their data if they want to go to another doctor or just want to keep their records, because there's some cancer patients in there for 10 years that have been off and on chemo, and all their files are on their own personal computer. That's insane.
Yeah, thank you. That's such a great, thank you, Frederick.
Yeah.
I sometimes get emotional when I'm talking about this stuff too. Yeah, again, when you have your data, you have some power. They're not magical powers. They can't erase what has happened, but they can, put the power to make a difference in your hands. And again, researchers often struggle to find data. If we can collectively, as a community, say, we have it, come do research, come look at our registry. It's not just a great survey registry, it's a great survey plus clinical data registry of people who are willing, who have, given their consent to contribute it, and it's just waiting for you to come and get it.
And we have another question from Stacy around, how has this data been valuable? What are some of the things that patient data located in medical records have helped do? One of the examples we always cite is there is a breast cancer drug that wasn't approved for men. I don't know if everyone knows, but men can get breast cancer. And a lot of the approved drugs that women with breast cancer take aren't available because those clinical trials didn't have men in them. It's a very rare subtype. They were able to use the data located in patients' records to create a data set of several hundred men who had taken this particular drug and get it approved by the FDA as a medication approved for men. And so that's just one example of kind of how this real world data can be used to have label expansions. It can be used for so many things. So I don't know, Deven, if there's other kind of success stories you want to highlight that.
No, I mean, if I think about, if you think Melinda and I were giving a presentation at a conference in DC called Health Data Palooza on the partnership between Citizen and CCF. And we happened to meet David Feigenbaum, who has Castleman's disease, which is not a cancer, but is a rare condition that he basically, by getting all of his data and putting it out there for researchers, not only was able to diagnose himself, but to figure out a treatment that would at least keep the condition at bay enough for him to live a life, to get married to his college sweetheart, to have a child. And it's kind of an amazing story. He actually wrote a book about it. It's just yet another example. It's outside of the cancer space, but it's yet another example of how that, this sort of power of people coming together with their data can just make a huge difference.
We do have a couple. Oh, sorry. We
do have a couple of questions in the queue.
Questions. Do you want to talk about the cost one more time for signing up?
Yeah, sure. It is free.
Yeah,
it's free for you to use. We don't think people should have to pay to get their medical records. We think it should be free, and even if it costs us something, we will pay it because we think you shouldn't have to. And again, ultimately, federal policy is changing, and in 2 to 5 years, it will not be. People won't have to pay across the board, but today they do, and we don't think they should. So it's free. Now, do we have a working protocol for obtaining records for deceased? Now, it's interesting that you brought this up, Patricia, because we are just very close to releasing another version of the product, which will allow you to indicate, to join Citizen and indicate that you need to access records for somebody else, whether it's for a child or someone that you're legally responsible for, or that you have, some sort of legal connection to. So a child is a key example, and then someone who's deceased. So that will enable you to go through the Citizen flow and to sign up. But we can handle, but until those changes are in, we still we could onboard you, and we will, because we have the letter, we have the letters that we send, like we're ready to start asking for records of people who are deceased. And I'm actually really excited to get started doing that, because we want more experience at what kinds of documentation some of these facilities are going to seek in order to meet those requests. So we're actually pretty eager to get that going. And we're building in an onboarding flow, but in the meantime, we still could do this.
And we will let you know the second that it is live on the platform. I know that we speak with and know many caregivers, both of patients who have passed and are living, and the more data we have, the more we can do, and that includes the people that we've lost along the way. And so this is a really important thing that we're enabling, and we will be announcing when it's available to everyone shortly. So I'm not seeing any other questions, Rick. I wanted to highlight that if anyone wants to stay on, and you're going to have to do a bit of a Zoom jump, I'm going to stay around. If anyone wants to sign up for Citizen right now, let's walk through it together. It's free, and it'll take less than 10 minutes, average just 2 or 3. You just need your driver's license handy for the reasons that Deven just explained, so that we can verify your identity to the health system. And I would love to walk you through signing up and get you all of your medical records.
And I just put the link in the chat box. So if you haven't already registered for that meeting, which is in about 5 minutes, go ahead and click that link and you can register and join us.
And final closing thoughts, Deven? Otherwise, know that you can always get in touch with us. You can visit citizen.com/CCF to learn more about our partnership, the study that we referenced. You can always sign up there. And then also, if you have friends, family, loved ones who are affected by cancer, we would love to also help them. So you have the ability to invite friends right in your citizen profile, and always send people our way. We would love to use our technology to help them make this a little bit easier.
Yeah, you know, I'll add just one other thing that we didn't get a chance to emphasize, and that is, you know, it is your choice about whether to share your data. It's of course always your choice about whether to join Citizen, and it's also your choice whether to stay with Citizen. Like if for some reason you're not happy after you join and you want to take your data and go home, you can do that. We'll be sad to miss you, but we won't give you a hard time about it. You can go. This is, you know, we intend for this to be a tool that people want to use and like to use. But if after you've joined you're unhappy for any reason that we can't fix, you know, we will wish you well and send you off with your health data.
Thanks, you guys. Thanks for doing this for us and giving us our webinar today. We really appreciate it.
Okay.
Well, and really nice to get to hang out with all of you this afternoon.
I know, this has been fun.
And so come, if you haven't already signed up, if you want to learn more about onboarding, please come join us. The link there is in the chat box, and we'll see you in a couple minutes. Thanks, everybody.
Bye, everybody.
Bye.
Thanks for your time today.